Okay, so management of these types of things. Number one thing is protect yourself. Don't get yourself overcommitted. Don't walk into something as soon as you recognize if you're in it. It's probably too late. So situational awareness as you approach these, as you enter in to these types of scenes. Try and remove the patient if it's individualized, isolated patients. Try and remove them from the scene. Derek, remember that the couple that had the fumigated their house call? So crazy call. I don't know if I've told you guys this. So we had a call where it was a cardiac arrest dispatch, and we get there. We got an old man standing at the front door, and he's coughing and hacking. And like we're just thinking he's emotional, right? He says she's in the back. Yeah, they came in together.
I'm glad you noticed that.
You guys seem to think there's a problem.
Oh,
You guys are trying to iron out all your differences. I get it. That's cool.
You just missed the rock.
You did miss the rock.
Can you go back a slide?
Nope.
Mark, can you ask if we go back a slide?
You want to go back a slide?
No.
Mark? I'll do it for you. Yeah, so we respond cardiac arrest, the old man, he's coughing at the door, and it's like, okay, we're thinking he's emotional. She's like, yeah, she's down back there, I don't think she's breathing. We're like, oh, okay. So we go walking into the house, and we go all the way back into this back, like closet / bathroom thing. And sure enough, there's a little old lady sitting on the toilet, and she is pulseless, apneic, and still warm to the touch, and he's just like, yep, she went in there, and came in a couple minutes later and found her unresponsive.
And she's still sitting.
And she's still sitting on the toilet. Yeah. Okay? And so we're like, oh, okay, so it's me and another partner. Partner's like 6'4", like, man, he's got to be 250, 260 pounds, right? And then you got me, right?
Big boy.
Big boy, like two of Derek's put together, right? So this guy's a big dude, right? So we get in there, and so what do you do with cardiac arrest with somebody on the toilet? What do you immediately do?
Get him off the
Get
spot.
him to the floor, right? So we put her on the floor. Within like 10 seconds, all of a sudden, this big old partner's like, and I'm like, you all right? And he's like, starts just like doing this weird like neck noise thing, and I'm like, what the? It's like,
neck?
he didn't.
Who said that? You said that?
So he's having, so something's wrong with him. I don't know what's going on, and he's just like, he's like, there's something wrong. There's something in here, and I'm just like, whatever, dude. Like, I'm not noticing anything, man. Right? I'm like getting ready to manage the airway. I'm getting ready to intubate this little lady, and all of a sudden he's just like, he's like, something's wrong, man. I think I'm going down. I'm like, no. I'm like, what? He's just like, there's something in here. Well, about that time, my eyes start watering. And I'm just like, oh, wait. And I get a little tickle in the back of my throat. And I'm like, oh, no.
there's something in here.
I'm like, he's progressed farther than I have already. And I'm just like, oh, no, this is not
He's a
good.
big guy.
And I'm just like, and so, like, he, like, grabs onto the feet. I'm like, let's get her out of here, not knowing what's going on. And so we just grab, and, like, we're going, and, like, so he's got the feet, I got the head, and I'm going backwards. And he starts doing this weird stumble thing. I'm like, oh, no. Like he's coming at me like, I'm going down. It's like, I'm like, no, man, we're almost there. And like, I just kept moving. Like the whole time I'm thinking, like, there's no way I'm getting like both of them out at the same time. I'm like, okay, priorities. Okay, top priority. Yourself first, your partner second, patient third. I'm like, yourself first. Got it. And so so about that time it's like, my throat's starting to get a little tight. I'm just like, okay, something's definitely not right. We get out, and we both kind of stumble out. We put the person down, and back then we would call for another medic unit whenever we would have a cardiac arrest. So about that time, the other medic unit's getting there, and next thing you know, like, my partner's gone. Like, he's just like hands and knees over, like, like he can't breathe very well, and we're just like, holy cow, what's going on? The old man's now sitting on the little side thing, and he's hacking and stuff. I'm like, what in the heck? And so, of course, like, I'm like, yeah, I got this tightness, but now that we're in fresh air, it's kind of clearing up a little bit.
Ammonia and bleach.
No. So, long story short, she ends up not making it. My partner survived, thank God. So, what had happened is, so they had their house fumigated and had stuff sprayed at, like, was it 10 times the normal dose? So the person that had applied the wrong amount. Right? They were supposed to. weird, huh? And so, it ended up like, they ended up calling like the fire department in to do air monitoring and ventilation. So what had happened is they opened up the door after the, whatever, 6 hours that they told them that they had to be out, walked in there like normal, and she went straight into the bathroom, and within a short period of time, she's now unconscious and unresponsive, until they asphyxiated from the fumes. But it's that kind of thing. We're just going on a cardiac arrest with a little old lady, walk through the door, we're doing our normal thing, and all of a sudden, I hear this hacking from Gigantor, and I'm just like, oh, Lord help me right now, this is not gonna go well, right? And so those kinds of situations, you don't know what you're walking into sometimes. And so just being able to, okay, well, something's wrong, we need to change our plan immediately, and we need to make sure that we can get out of here, all right? So, remove the patient from the environment, we were able to get the person out, work cardiac arrest. Surface decontamination, what kind of stuff is this?
Is that where you're talking about the powder that you
Powders,
guys
right?
managed?
Right? Do we wanna add water to powder?
No.
How do we wanna get rid of powder on somebody's body? Chemical stuff, yeah, brush it off, right? So, brush it off, do we wanna use an air compressor and be like, pshh,
As long as it's towards your
towards your
buddy you
partner?
don't like.
As long as it's towards your paramedic student that you got right, right?
Do you guys use the charcoal pads?
The what?
They're cleaning pads, but they're embedded with charcoal to like wipe off?
No.
Okay.
Nope. Nope, we have nothing special to wipe that stuff off with. All right, ABCs, do our normal treatment based on the presentations that we get then. All right? Absorption, these are our organophosphates. Okay, these are the majority of our organophosphates. Is you see this right here. People out in the fields spraying the pesticides, not wearing the right mask, they get it on their skin, they don't take the showers, they've probably been out doing it multiple days in a row, and so that's where you're gonna get your absorption. And what kind of signs and symptoms are they gonna present with?
Sludge,
Fluid from
What?
everywhere.
dumbbell.
Dumbbell, sludge? I don't even know what sludge is.
Pretty pretty. Salivation, lacrimation.
They're gonna be leaking everywhere in alternate LSC.
Everything's leaking, right? Fluid from every orifice, yeah?
Frank and cow.
That's not mine, don't touch.
Bringing out, right? And we manage that, these stupid things.
With atropine. Atropine.
Absorb through the dermis, we gotta talk about this stuff.
Hyperactivity ensues.
Initially, and then it shuts down, the hyperactivity in your bowels. There we go, atropine, there we go. Suctioning, right? Suction, PPV. What's PPV? Okay, and then drug administration, 1 milligram every 2 to 3 minutes. So some of you we've kind of talked about like the mass storage locations that there are around Lane County. There's a ton of it out there. Hazmat team has access to your 2-pan kits, your atropines, and so the hazmat teams have multiple amounts of it available. And so how much do you guys think a normal ambulance would carry?
1 to 2 boxes.
Oh, the atropine or 2-pan?
Atropine.
5 milligrams.
You think you got carry about five boxes?
Maybe.
Yeah.
Maybe 1 or 2 in the kit and maybe 3 in the wall.
Because we're only gonna give 0.5,
Maybe.
which is half a box.
Okay.
And so maybe 2 boxes, but
Yeah, usually you're gonna have 1 in your kit. You're gonna have 1 in your kit, probably 2 on the shelf in your Medicaid. So you have 3 milligrams. 3 milligrams. How many minutes does that buy you?
6.
9 is the
6
very
to
most,
9.
right? So you have 10 minutes worth of atropine in your rig.
Sucks if you're in the rules.
I was just gonna say, and we talked about this last time, where are most of these happening?
out in the
In the
farm.
rural, right? Because this is where all the farmland is and stuff. So what do you have to do with this?
Call early.
Call for help early. But what's even more important than calling for help before that?
Knowing what it is so you can call the right people.
Recognizing what it is before you're behind those people there, okay? And then if they go into seizures, then we treat that aggressively with our Versed.
With our
right?
benzos.
Or diazepam, depending on what you're using. Dries of secretions. So, what do you think is going to be one of the first ones that you're going to see
Try up.
dry up? Salivation, lacrimation, urination, defecation, salivasis.
Probably tears.
Dry nose.
You trying to figure out what it was?
I was trying to figure out what E was for census.
Yes.
Venus.
GI, just like stomach, yeah, cramping.
Or sweating, they're probably gonna start sweating.
So sweat,
They probably already have all that shit that's in their nose, that's not just gonna
it's just gonna
dry
dump
up.
it, yeah.
It's still gonna be dumping. They, all that, GI agitation is still going to be,
So with that GI agitation, they brought up a good question, like what's the difference between GI tract versus the emesis and diarrhea? The GI portion of it is like abdominal style cramping. So with now knowing that, what do you think is gonna subside probably first?
probably the abdominal cramping.
The cramping's probably gonna go away first, and then you're gonna slowly start to dry up the secretions in different
It's almost like it's gonna start from the outside in, it's gonna relieve itself from the inside out.
Yes.
Is it gonna dry up the secretions or stop producing more secretions?
So it's going to slowly dry them up. Okay, so that's why you're continuing to give until you have basically, it's gonna stop. So it's not gonna make it so that, hey, the sweats here just disappears, right? So it's gonna stop the production of the
Right.
secretions. So it's not gonna continue to produce the tears. And so it's a combination terminology
Yeah.
of, the secretions will subside.
Subside. Will we start pushing fluid too to make up for the, all the
So
fluid
can this person
loss?
become dehydrated very quickly?
Yes.
Absolutely, right? So if you got somebody that is vomiting, what else can we give?
Zofran?
Okay, is it gonna work?
No, they're already vomiting.
Now they're already vomiting, but is it gonna help potential? Do you have the
Maybe.
potential to be able to help reduce a little bit?
A little bit.
Yeah? How about diarrhea? Can we give you anything for diarrhea?
Not to stop it.
We can't give anything to stop it, but we can help replace the fluids.
Help
in
replace the
place.
fluids, right? Help replace the fluids and electrolyte.
So would we think about lactated ringers versus norsaline?
If we were carrying it, yes.
You guys don't carry lactated
No,
ringers?
because it's more expensive. It's a more expensive fluid. Transport, surface decontamination. You can have this person jump in the shower and take a shower beforehand. How are you gonna decontaminate somebody that's been within pesticides?
With a hose?
Hopefully a fire engine with you.
Is this somebody that you can put put water on this person?
For the chemicals.
You could look in your
I assume
ERG.
so.
ERG. Okay, that's actually a really good resource. Everybody know what an ERG is?
Yep.
Anybody not know what an ERG is? It's an emergency response guide for all hazardous materials. Basically, it references if you know what they were exposed to, or even if you don't know what they were exposed to, it gives you generalized decon procedures, isolation areas, and stuff like that. So, if I know for a fact that this person's been involved with pesticides, then I'm actually gonna take a hose and try and decon them with just fresh water.
Kind
Are
of
we
like
gonna
that
control
scene
the
from
runoff?
Tommy Boy.
Control the runoff, or we just let it head right into the stream?
Try and control it.
Control runoff, right? Alright, injections.
I'd be banging
Most common one that we go on,
heroin.
okay? How many of them actually get the needle out of their arm?
Probably not many.
About half of them. How many of them still have the tourniquet on?
Most of them.
Quite a few of them, okay?
I thought the fluid wouldn't push if we left the tourniquet on.
Right? I know, weird, huh? Alright, other injunctions? Son of a, yeah, there's a lot of getting marked down, lab one. Not to give anything away for lab two. So other injections, what other kind of injection toxins are out there? Oh, snake bites. Oh, what else?
Spider bites.
Do we get called 911 for spider bites?
Yes.
Absolutely. Is it a life or death emergency?
No.
Spider.
Depends
Not in
on,
Oregon.
Depends
Not
on the
usually.
spider.
Black widows
They're not usually.
Not
Oh, are we gonna get into this big debate
They
of
don't
what
usually-
spiders and
They
what
still go to
snakes
urgent
or
care
what part of the
or drive
country?
themselves to the ER.
No, we're not doing that today.
because Corey's not here?
Right, because, I mean, we could get into it and I could just solve all the world's problems and then just hand it off to him when it comes to animals, right? So there are a couple common US ones. You got your black widow and your brown recluse. Do we have
What do
them
you mean? I said
here?
it's not usually like.
Black widows, we.
Black Widow, yeah, we have them both.
I wasn't arguing that they weren't here.
What were you arguing then,
I
Lon?
said they were not usually life threatening.
Not usually life
Brown
threatening.
recluses are
Yeah.
life-threatening.
Let me just show you here. We're gonna fast forward through here so I can just. Okay, not life threatening. Mons? Mons. Not life threatening. Really? How can that not be life threatening? Well, shh, Melanie, don't jump on his side.
They wait till it looks like.
I'm rubbing on my own side.
Rub some dirt on it.
So,
Suck the poison out with
so looking at this, let's say theoretically this is somebody that maybe got bit by, they say, a spider bite. You get dispatched for a spider bite to the alleyway between Blair and like 3rd.
Is that a spider bite
Can I
or is
make a
that an
caveat to
abscess
that?
from their heroin use?
So,
Wait, can I make a caveat to that?
Bless you.
That they called 911 as soon as it happened, as
no,
opposed to like
no.
a couple days later. and they're
This is a
like,
couple
"Oh,
days later.
This is how it usually is. Oh, a couple days later.
You know, I had this bite and it's just gotten worse and worse and worse and worse and worse, right?
Yes.
Because are these people are these types of patients the ones that will seek
No.
treatment right off the bat for stuff?
No.
Or do they wait until things are, I mean, some of them, yes.
That's why I was trying to make a caveat.
And so,
They did not call.
is this a potential life-threatening thing here?
Yes.
Yes.
What
Looks like
type, how can this person present, other than a giant wound on their leg?
Feverish,
Probably.
altered
High
OC.
Hypovolemic.
Infection.
What does it, what do you?
Sepsis.
Sepsis.
Oh, thank you, right? This person can be super septic, potential, right? How are you gonna know if this person's septic?
A little steamy.
Specific protocol. Altered LOC.
One at a time, okay. Altered LOC.
Where's the football?
High temperature.
High
Oh, hold on, oh,
I
yes.
can just.
No, I don't want you to, that's a problem. Okay? So we have altered LOC, yes?
Yes.
I'm so excited for this thing. Oh, you want it? Ha! Oh, geez, James, a nice catch.
Temperature.
Temperature has to be what?
About 99.
It just has to be a couple degrees over what their normal is in order to start showing.
There's a specific number. Mons. Mons. It's close to like legit like defib, not pacing anymore. Defib. Josh. Oh.
Over 38 or under 36, something like that.
I don't know what this 38, 36 numbers are, because our little monitor says like 98.6.
That's gonna get you when you have somebody else's monitor that reads Celsius.
100.4. Does everybody agree with that?
No.
No, we
Yes.
gotta know. We
Mon
get-
says no, so it must be wrong.
Or no. Greater than 100.4? Or below. Or below. Sorry.
Or below what?
96.8.
96.8. Okay, so we have a temperature. We have an altered LOC. I'm not even gonna look at you anymore. Oh, Chad.
Oh!
Fumble!
Accelerated respiratory rate.
Of 20 or more? Anything else? Maddie, here we go. Oh, never mind.
Heart rate over 90.
Heart rate over 90?
Can I make a request in class? Can we call on Maddie like a lot more?
Yeah. we
Everyone
can.
needs to call on Maddie a lot more.
Okay, we'll put
I
Maddie.
basically only want, I want to hear from Maddie more than
Okay, anything else?
Yes.
Oh, Andrew.
Oh God. History of known infection.
Oh, do we have a known infection history here?
Yes.
Are you saying this is infected?
Oh, it looks clean. Looks like he's been doing a good
Yeah, I
job.
mean, it looks like there's good irrigation.
but now you look at it once and then now you don't remember.
I mean, he's even wearing gloves and gauze.
Are we gonna put a cold compress on this?
Not directly.
Probably not. What are we gonna do with this? How are we gonna manage this?
How are we gonna manage it?
Go ahead, give back if you can't think, because I mean, paramedics don't need to think fast, right?
I was
Paramedics think
still
fast?
on the symptoms.
I don't know. How are you gonna manage it, Blake?
Decrease intel.
Oh, we missed it.
Oh, 25. Oh, you're looking it up.
Oh,
I don't.
Cody's over there sleeping,
talking about,
sleeping on the
Raj?
job. Where's the ball?
Sorry.
Oh, Chad's got it. Chad, you might as well answer now. You got it in your. Uh-huh. Sorry, I blacked out. Okay. What's the question?
How do you know if it's infected? Or what do we do if it's infected?
Trauma dressing, we want to put something moist on here, or are we gonna keep it dry?
I need lactate. I need lactate level.
Moist.
I think moist too.
Dry, it's gonna stick to it, then you're gonna rip it off.
What do you guys think? All in favor of moist?
Wet?
Moist? All in favor of dry?
I like it better.
I'm gonna keep it dry. Because is this already pretty
Wet?
wet and soggy? Right? What's gonna happen as soon as they get to the hospital?
You're gonna take it off.
They're just gonna take it all off anyways, right? And what happens if you add a bunch of saline to this?
Then you're irrigating it.
What's gonna happen? It's gonna do what?
It's gonna drip.
It's gonna irrigate, it's gonna get all over everything, right? It's gonna start to bleed even more if there is
So
capillary stuff.
what you're saying is, you're saying, how can we wrap this for the 3 to 5 minute transport to the hospital,
Yep.
not
Not
how,
long term.
how can we,
Fix
how
it.
can we take care of this wound treatment?
Correct. Because because what's gonna happen here is they're gonna have to debride it.
Right.
And completely clean it out, scrub it, try and get as much of they'll probably do it in lance a lot of that tissue out. And they're gonna end up with a big divot in their leg probably. Alright. So it starts off up here. This is an early stage, right? That's day 1. This is 6 hours after that.
No.
I'm just kidding.
Where'd you pull that out?
A lot of these patients also go to the burn unit in manual, where they don't just do burns, but they do if that needed to be grafted or something, that's what it is.
Silver.
We have lots of scorpions here to make sure that you know the proper treatment. Once again, it's another sting, right? This is another sting. Tick bites. Oh man. Anybody have any animals, dogs, that live in a country that are the worst things ever for getting ticks?
That's in front of Lyme disease.
50 in one day.
Off your dog or you?
So do we get called 911 because somebody's got a tick?
Oh,
Probably.
probably.
We get called for everything,
Yeah.
right? So yes, we get called for somebody that has a tick. What do?
Laugh at them?
Burn it out.
You put Vaseline over them and suffocate them.
No.
Or you grab the
You-
freezers and just.
You get it as close to the head as you can and pull it out.
Freezers, you gotta make sure you get the
Do we go counterclockwise or clockwise?
You don't twist
You
it.
do not
Oh,
take-
we don't twist it? Wow, but that's what everybody says, yeah, you
Right.
just twist it.
Everybody says you burn it out, you twist it out, you counterclockwise it out, you do whatever. It's just you get as close to the head and pull it out.
You just basically dig it out, right?
Is it the thing on the bottom? You bite it out?
Yes, you bite it,
Bite it out.
right? Is this something that somebody needs to go to the hospital by ambulance?
No, I would
Can they
prefer
find
not.
another route of transportation to get there?
Prefer not in the back.
But do they want to go with you?
Yeah.
Alright, snakes, we're not gonna cover snakes, right? What's the most common poisonous snake we have around here?
Rattlesnake.
Rattlesnake.
Rattlesnake, right?
Protect yourself from snakes.
I've seen them up at Spencer's Butte.
Yeah, they're actually up there quite frequently, like, especially late August.
Yeah,
Have you
They're
ever had a
actually,
bite?
When they get dry, when they get
we've
straight
never
up.
actually had one, which is pretty impressive.
that's impressive.
But once again, at the Young Life Camp last year, the guy I went with, so we have this bike rack where all the kids park all their bikes and stuff. Well, the kids go to grab their stuff, it was right at dark, and they're like, hey, we're gonna ride down to here, and we're like, oh, okay, cool. So the kids all go out, grab their bikes, and then they run around, they come around to the front door, and they're like, hey, by the way, there's just a big snake out by the bikes, kinda scared us a little bit, and they took off, and we're like, oh. So me and the other paramedic were like, hey, let's go check it out. We walk out there, and we're like, oh, son of a. And it's a rattlesnake sitting right there where all the kids were at, grabbing their bikes and helmets and everything like that, right? So then what do?
Take
Cut
a
its
Oh,
head
is
off
it?
and fry it.
Kill it.
Right, so like we get to try and do this, right? Snakes totally hold still for you, right? Yeah, we try and do the tough guy thing. Like I talked about, remember the bites, yeah.
Did you have a white beater on?
We did not.
You have a beer in your
Hold
hand?
up, there, watch this.
But like it's so warm over there. What I'm like in shorts and flip flops chasing this rattlesnake around with a shovel, trying to get this thing right. So all right, ingestion.
Inhalation.
Or,
Oh,
we
You're on the
don't
bottom
know,
black one.
injection,
There you go.
ingestion.
There you go.
Purple. Ooh.
Oh, yummy, yummy, yummy.
Beer and
Uh,
Is that
let's see.
beer and pizza?
Activated charcoal.
1:30, right?
White trash pits.
1:30, okay. Don't look at the caption,
Is that what you typed in?
That's why I love you guys. That's why I love you guys. I can't get anything past you guys ever. Ever. Okay, what is Epicac?
Epicac is something that makes you vomit.
Makes you vomit.
Do we have that in the pre-hospital setting?
Not anymore.
Pick it up at the right age.
Gastric lavage. Has anybody got to do that in the ER yet?
No.
Oh, that was one of the first things I got to do when I was a paramedic intern. They're like, hey, guess what we're gonna do? This girl took a whole bunch of these pills and it was like 20 minutes ago. We're gonna gastric lavage her. What does that mean?
Suck out her tongue.
Put water in and then suck it out.
So they put a ton of fluid and water in an OG tube down into the abdomen. And basically, a funny video to watch is if you watch, there's a gal that took an entire pack of Mentos, mint Mentos. She just swallowed them all whole in an entire pack and then took a 2-liter bottle of Diet Coke. And then she just started doing this thing with her belly, just shaking it up.
How'd that go?
So she was maybe like 100 pounds. By the end, she looked like she was like 9 months pregnant, like just this ginormous. I'm like, that can't be healthy at all. So it's not quite to that extreme when they do a gastric lavage, but they end up putting just a ton of fluid, big, like maybe 2 to 3 of those big like potassium bags in. They're just humongous amounts. Put a ton of fluid. Now he's gonna. I was gonna Google it at the end here, but so yeah, so you just tons of fluid goes in there. It helps to kind of get the pills off the membrane of the stomach, and then they go in and they suction it all out. Okay. Activated charcoal. We talked about that. Ooh, the whole bowel irrigation.
Dun, dun, dun.
That's what you do in the field.
Really, it's even listed as a challenge now.
I know,
Oh,
right?
no.
Coke and Mentos challenge.
No.
All right, so Epicac, you got multiple doses. You take the whole bottle. You're gonna puke your guts out for a long time.
And that's no longer in the pre-hospital.
No longer in the pre-hospital setting. Here's your gastric lavage tube. That's a big old tube that goes all the way down into your belly. You got to do it within 30 minutes, so because of the absorption. It's kind of a lot like our activated charcoal amount. A lot of times what they'll do is we'll start the activated charcoal, and then they'll follow it up with this. They don't do this quite as much anymore. There's our activated charcoal. Oh man, did it go
Body
away?
packers?
Oh, it did. Gosh dang it. I thought I saved it last
Stuffers.
night. I had names up here attached to some of these things. It would have been fun.
Who was the body packer?
It doesn't matter. So it would have been funny, but all right. So whole bowel irrigation. So we have body packers. What is that?
The moth.
You guys have no idea.
Ideas, but
You're
they're
sticking
probably not
stuff
what
up
they
there.
mean.
Yeah, good. So Mark's in timeout now. Mark can't be involved.
Key stirring show?
What? Boy, like it's almost as if like we're teenagers in here. Any ideas from a medical standpoint? What a body packer would be?
Plug in the exit?
Yeah.
Dustin, Lindsay,
What?
what is your idea?
Wrong person.
Come on,
Wrong.
you guys. Somebody have some idea?
So,
No, you're still in timeout. Oh, James, yes, thank you.
Are they plugging up the exits?
No.
That'd be
All right.
this is for a whole bowel irrigation?
So body packers, basically they will take the balloons full of drugs. Okay.
Oh.
They'll pop them in.
That's not from a medical standpoint.
Okay, so they'll pop them in there, and then.
Isn't that a mule?
Yeah,
Just-
drug mule.
So.
Key stirring.
Let's say
Sorry.
it again. Say it again.
So,
That's a prison
so
purse.
there's a difference between packers and stuffers, right?
Mark, what's the difference?
Chris is going to tell us. He's going to show us.
One goes in the
So we're gonna have a demonstration. So Mark, come on up here and assume the position. Okay, so the packers knowingly try and package the drugs in a secure device, they swallow it, they hold it, and then they pass it.
Ooh, I had a girl in
No.
the ER that
Hold on,
that
just
ate a
stand
bunch
by.
of heroin.
Stuffers are the ones that they're driving along and oh shit, there's the cops, they're pulling them over. So what they do, they just randomly just start eating all the drugs, right? They'll just eat unsecured, non-prepared
That's the
bags.
beginning of Super Troopers.
Right. Okay?
Don't Google stuffers.
No. And so the difference there is like the absorption is going to be much quicker most of the time with the stuffers because the packaging isn't complete. Packers are more over there, the professional mules getting things from point A to point B. We don't have to deal with a lot of it. Although I-5 is probably the top transportation location in almost the world for methamphetamine. And so nothing like having somebody that gets pulled over and starts downing a bunch of stuff.
With eating it, or
Yeah, just
because
taking the,
it doesn't make sense that they would be driving somewhere and
With
body
it.
pack it.
right, no. And so.
But
NG tubes needed, so the whole bowel irrigation, so how does that work, Mark?
I would assume it's just like a colonic, where they put a tube up your rectum and start shoving water in there, and another tube that siphons it out. I think Jackass
They did.
one, and they put cars in.
I was gonna say, and so you'll notice that they had little matchbox cars, and then they show up for the x-rays and be like, oh, I got something here, and the doctor's like,
What?
what in the? Yeah. Okay, so when it comes to taking things, everybody lies, right?
Yeah,
What are they, how many beers have I had?
2.
one.
It's always
Two.
two.
Always, it's always two.
Gotta get out a little more,
Nice.
expand your horizon, right? Just-
One's being a pussy, two is like just right.
Yeah, poisons are all over the
Yeah.
place. Most common are in children's because they have easy access and they don't understand things, right? If it's a bite or a sting, chop the head of the snake off, take that snake with you. Yeah?
No, you take the whole thing
Alive.
You
alive.
gotta kill it first. Come
Oh,
on.
bring it.
Put it in the snake.
Do you know what the reward is for killing a rattlesnake?
Prison?
You get dinner.
Fine.
The meat?
No, you get to keep the rattle, man. That's like your bragging rights because like the more rattles they are, the older they are. So if it gives them old veteran, then those are big deals.
Have you ever eaten one?
I can't say that I have.
They're delicious.
See where it's in,
It tastes like,
Chicken and
they
All right, make
taste
sure
like
you bring in your
reptile.
fill bottles.
Oh.
Fill bottles. Alright, all our airway management, we got all that, yes? Boom,
Yeah.
boom, boom. Oh, I actually had a little comment right here at the bottom that specifically addressed paramedic students
Huh,
in
interesting.
your decision-making matrix.
Check CBG too.
Couldn't we also consider CBG?
That was in my comment that I
You
had.
were just waiting for us to fill in
Yes.
the blank.
And
What
so
am I
I
missing?
had this little thing, I'm just like, hey, let's try not to innovate somebody that we're gonna give Narcan to. It's not RSIM because we think that they are a trauma situation, okay? Let's see here. Covered, go to this, we're good here.
What was nitroprusic? Just halfway through that slide.
It's just another medication of nitro. like
Okay.
derivative of
That's
nitro.
it,
Okay, Tacoma cocktail, we talked about that.
yeah. We're doing Foley catheters?
Oh, yes, see, I had names on here too. Funny. When we started talking about Holy Catheters and rectal temps, there were specific names on here. I mean, yeah, like student names. I mean, I'm not gonna say anybody's specific name.
I don't know why you're looking at me.
Do we do Foley catheters?
No.
Is it in the scope
in
of
the
practice
scope.
for a paramedic?
Oh, it's in the scope?
It is in the scope.
Sweet.
I told you guys that Umpqua used to do this
On each
students
other,
on each other. Yeah. Like I had a paramedic or a coworker that was going through the paramedic class, and of course I get a random text message one day and be like, hey, look what we're doing in class today.
Was it all male class?
That I couldn't tell you, but
I'm curious.
I couldn't tell you.
Information.
Yeah, I couldn't tell you.
Well, females
Because it was
get Foley's
Umpqua.
too.
Yeah.
So I don't know.
And it was a while ago, I'm kind of guessing.
So yes, so they were performing Foley catheters on each other. And so I just came up with the idea that I'm
I
allergic.
apologize.
So like, even like, I'm allergic to Foley catheters in any, if I look at them, yeah, I get hives and rashes, right? So I can't touch them, so I can't do them, and then they can't touch me. So Foley catheters and I, we just don't get along.
So are we gonna have
Yes, we're gonna have a lab.
lab on Foley catheters?
Yes. Yeah. Okay?
Oh, so I could do it in hospital.
Does your medic
I've
unit,
done.
carry?
Not anymore.
Oh,
Nope, not anymore.
You used
So
to?
we need to know how to do it.
Yeah, we used to. Yeah, we used to have Foley caths.
holy cow.
Yep. I'd say, so let's see, what year are we now? 18?
19.
19, so 2001, so 18, I'd say maybe 15 years ago. So when we kind of got rid of them off the pre-hospital
Did
setting.
you learn them in your medic class? Or you-
Yes.
Yeah.
Yes, we didn't actually do them, but we had pictures and descriptions, and it was in our scope of practice, it had policies. Because what we used to do is we used to give Lasix, IV Lasix, and so if you were on long transport time, you gave a whole bunch of Lasix, and now all of a sudden you're just like, oh, yeah, now you're screwed, somebody's gotta go to the bathroom now, right? And there's nothing worse than trying to go to the bathroom
Yeah.
on an hour transport. I mean, I'm not saying I haven't pulled over for somebody to hop out of the rig and be like, okay, go to the bathroom.
You just put it fully in yourself.
I never did it because I'm allergic to them,
Brr.
okay?
Even,
But they were there for that reason. They were there for that reason.
We gave another medication, mannitol, for spinal cord injuries, it's a diuretic, and that was the main reason we carried it. Then once we got rid of mannitol, we didn't really want those.
For multiple reasons.
Multiple-
But in the ER settings, you guys are totally,
I've watched multiple
yeah.
Foleys.
You should be like, hey, can I do that?
Well, I didn't, if I knew it was in my scope, I would have.
Thank you.
Thank you.
they keep asking me to wipe the sheet.
Literally, like, was
around so we can get it into the-
I was really enjoying the nighttime.
Oh, yeah.
Yeah, we couldn't just open the thing and
There was like, this, there were folds.
So does that mean in the ER, if there's a Foley, we can ask the nurse to do it?
I would say, I wouldn't necessarily say, hey, can I do it? But I would definitely like be involved with,
Yeah, I've been involved with them.
yeah.
The nastiest thing I've seen.
be-
Really?
Yeah, with helping and participating. Multiple treatments for agitation, multiple treatments for seizures.
What was that? Oh,
Procedures is first line and then where I've been.
It all depends on your scope. What you have in your scope of practice, what your department carries. And that's why all of these are listed. So like, all of these are a
So they're
combative
not in a
patient.
particular order?
No, nope, no particular order here at all. These are just different options.
Is Haldol in our national scope?
Yes, yep, because we used to actually give it.
The sky.
So we've actually had all of those in our scope of practice at one point.
That's why it's so dark. 'Cause it's pouring down right now.
Because now we have a tornado happening.
What is Haldol? What's the classification? And I can look it up.
No, it's not like Toradol at all.
I saw the look.
No, it's a sedative. I want to say it might be a hypnotic. It might be Geodon might be the, is it hypnotic? So,
I think it's hypnotic.
Oh, they said it wasn't.
Stupid.
let's get to, oh, here we go, all right. 69-year-old male with chronic low back pain presents with a change in mental status.
That's not what I wanted to open. My phone. I was trying to look up Haldol.
Hello, okay, well, okay, oh, Janae, gonna participate, okay.
What's a CBD?
CBG is 88. Levi, it's gonna start coming fast, so you guys better be ready.
Vitals.
Vitals, what's the first thing to suspect with this person?
Probably no OD if it's a mental thing.
Really? You're going with a 69-year-old male with chronic low back pain?
Yeah,
So here's a question. So we're thinking, you guys automatically all jump to OD, right? Like you think maybe this person's like stroking out or
Maybe.
having one of these more critical things. Maybe
Well-
this person's having a major cardiac arrhythmia right now.
But change in mental status is rule out CBG and rule out narcotic.
Oh,
And
so we
then-
have our altered LOC protocol that we got to do, right? Okay. Yes. So. Is this a hey please throw me the ball kind of thing?
No.
Okay. Just checking. What about this? 26-year-old female found in the bathroom, found unconscious with a syringe on the floor.
CBG and pupils.
Okay, so both of these patients had the exact same thing going on with them, but yet they
Altered
present
LOC.
completely differently, right? So they have that altered LOC that you guys are now so in tune with because we've messed with you so many times in your scenario world that you guys now know that I'm checking my blood sugar and I'm checking this every single time, even if my person was hit by a car at 1,000 miles an hour, right? Because that's what I. What?
I said, but.
Oh, I love butts.
I do too.
Okay, first thing would be.
Yes, Melanie. Huh?
I said, I already said.
You already said what?
ABC.
Huh? ABCs? So yeah, you do your ABCs, you do your CBG, you do your unconscious, unresponsive, right? So you still work through all those things, right? So you're gonna put them on oxygen, check their gag reflex, you can do all that stuff, right? But before you progress to those uncorrectable actions, such as intubation,
Right.
you're gonna fix the things, right? So both these patients present exactly the same, okay? And so it's just figuring out which one you're gonna go with. Let's see. Boom, here you go. 18-year-old male brought in with EPD because he's acting crazy and violent.
Is he in Eugene?
EPD.
Meth.
Oh,
I mean, he said he
Matt.
wouldn't do his homework.
Coke.
Or
Blown.
8 million. Boom.
Withdrawal.
So.
Coke.
Withdrawal.
Coke?
Coke.
And Mentos.
Your stimulant's gonna blow it?
I believe so.
Or.
oh, you can't be
Well,
dodging it.
Meth is your stimulant too. So Coke or meth.
No,
have the
no, look at the
same
ball. Now it's
mechanism.
you're just gonna have to be totally ready to have football now. So, what are we thinking?
Stimulant?
Coke.
Is this normal?
No.
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 Oh, jeez. Sick or not sick?
Well, diaphoretic with those vitals are normal.
Hi. Hi.
On Coke.
Well, a stimulant. Right? You can't rule it out for Coke, or you can rule it out for a stimulant.
What are we gonna do for this person?
Classify it. So, as per Ally, we're looking at beta blockers.
Oh, yeah, I guess that's my topic.
Your topic?
Beta blockers for meth and cocaine.
Like the correction?
No, yeah,
Yeah, I
there's a
think that's
topic
what they're
of,
trying to-
for our research. For using for meth and cocaine, beta
Still the heart
blocker.
rate.
Yeah.
Gotcha.
But isn't the
But that's not in our
treatment,
scope.
No.
right, it is our, well, the ER, they're doing their B52 with their benzo, their Haldol, and their diphenhydramine.
Okay, so this guy is crazy, acting out, EPD's on scene. They're having a hard time controlling this person. He is very hot to the touch, sweaty. No, he's not. He's not sweating. Well, he
He's
is.
not sweating,
diaphoretic.
he's diaphoretic.
That's what I said. He's diaphoretic. Well, I was trying to paint a
what's
little
that drug?
bit different. He didn't say.
PCP.
Chill.
What?
Okay. What?
Since Cody wants to say it, or it could be a head injury.
What would Cody want to say?
He didn't want to say it.
No, I without the football, you know.
Oh, good, good. You want to say something now? Or did
He
you?
just said it.
He took the glory from you?
Yeah, no, well, he gave him credit.
That's true. That is true.
Oh.
Oh.
It's like you guys are like two peas in a pod.
They fight because they love each other.
So how do we want to manage this person? Management.
Well, first talk with words. And see if
Words.
we can calm them down.
Oh, man, I can't wait till we start running these scenarios.
I'm gonna put pads in
I-
the chest
I like to-
today, going to
I like to wrestle with you guys sometimes every once in a while. Oh!
All right, Derek. Derek.
What is it, Derek?
Management.
What?
Yeah, Derek.
What's this
What are you gonna do? How you gonna manage it? Let's go, Derek.
Do it. Let's go.
Paramedics think fast.
Yeah.
Yeah, and you.
Poly,
Yeah.
Probably substance abuse.
pharmacology,
Allie, go.
This sounds
Here we go.
similar
We're going
to a
fast now.
patient I've had in acid trip.
Yeah.
How are you gonna manage?
So what's your treatment?
Yeah, treatment. We're going treatment.
Take ketamine,
Just like,
Do you want to ketamine this
Yes.
person? Yes or no?
yes.
If he's acting crazy and potential harm to himself and acting others around.
Crazy and violent.
Violent.
Yes.
You have made that determination that this person is crazy and violent.
Then yes, I'm gonna.
Yes, thank you. Oh,
Ketamine.
man, there we go. So these are all the determination of what you have, okay? So when you have something and you've made that determination, then you are absolutely gonna do that, okay?
You don't want
You
to
can't one-up me, you. Just so you know, I had the first idea. Okay, here we go. Oh, so here are some of those medications that this person could potentially be on, right?
What's-
PCP, cocaine,
These are
TCA.
MAOI?
These have names.
What?
These are personalized to this thing.
That's right. I thought about writing all you guys' special names on them and stuff, but
Special
I
names.
wanted to have a better presentation than, you know, the 3 minutes thing. He had to talk for 3 minutes. I had to
What's-
talk for like 2.5
What's
hours.
TCA and
Antidepressants. So you can be,
antidepressants? And MAOI?
Ace.
Okay.
There's a sticker on it.
Yeah, you just Google MAOI.